Perspective on Florida Gateway College Television is sponsored by Potash Corp of White Springs. Potash Corp, helping nature provide.
Hello everyone and welcome to Perspective. This is a public affairs presentation of Florida Gateway College. My name is Mike McKee and my guests on the program are two nurse practitioners that work under Dr. Michael Ukebu. We have with us Jennifer Scott and Inez Davis. They're going to talk about the role of a nurse practitioner in a practice of medicine. We'll do that when we come back. Don't go away.
This is where it all begins, where a simple stretch of dust and dirt is wondrously transformed into a wellspring of life. The nitrogen we pull out of the thin air and the phosphate and potash we free from deep beneath the earth, thoughtfully applied in measured amounts to the soil, has fueled the greatest period of food production in human history. Pixie dust doesn't have a thing on the transformative powers of N, P, and K. And yet, if we've learned anything over the last 25 years, it's this. The real magic does not lie in the nutrients we provide, and it extends far beyond these furrowed fields. The real magic lies in you, our shareholders, our customers, our employees, who have managed to nourish so much more than corn or wheat or beans. You who have nourished roots that run so deep they span generations, who have nourished small businesses until suddenly they're not so small anymore, who have nourished local economies and spurred the global economy in the process, who have nourished young hearts and minds, inspiring them to change the world for the better, who, with your own bare hands, nourished hope where little existed, and who have nourished the fertile ground on which we all stand as we face our most important 25 years yet. Over the next quarter century, another 1.5 billion people will call this planet home. And thanks to you, warnings of the pending population boom may one day simply become, welcome, we've been expecting you. Yes, this is where it all begins, and where it must never end. Because what we nourish most of all is human potential. So, happy 25th anniversary, Potash Corp. While the anniversary may be silver, your contributions are worth their weight in gold.
Welcome back to Perspective on Florida Gateway College Television. We'd like to thank our corporate sponsor and corporate partner, Potash Corp, and we'd like to wish them a happy 25th birthday as well. On the program today, we have two nurse practitioners. We have Jennifer Scott and Inez Nichols. I know I called you Davis earlier. I didn't mean to misspeak, but welcome to the program.
Thank you. Thank you.
A lot of folks who go to see the doctor sometimes see a nurse practitioner, and our goal today is to educate the public on what your role is in the practice of medicine here, and you're in Dr. Michael Ukebu's practice on Stonegate Terrace. Tell us a little bit about what you do.
Well, we take care of primary care for patients, diabetes, hypertension, obesity, COPD, coronary artery disease, you name it, we take care of it.
Now, do you, people come in, they got aches and pains too, or typically what is someone, when they come to see the doctor, what's typically their problem? Is it they just don't feel good, or there's something different about their situation?
Usually they're coming in with a particular complaint. Sometimes it's something that's kind of multifaceted. It could be fatigue. So they come in and they're not really sure what's wrong with them. So we get a list of diagnosis problems that they have and try to figure out what the originating problem is and go from there. It can be a multifaceted issue because fatigue can be depression, can be anxiety issues, it could be anemias, it could be heart disease. It could be diabetes, and it could be obesity related as well. So
Inez, your role is kind of like asking 20 questions, right? You're asking, okay, you're fatigued, so let's check this, and this. And so you kind of weed things out?
Kind of just go from head to toe, asking different questions, different systems to kind of investigate what systems are bothering the patient or could be adversely affecting them. We also have that patient that wants to stay healthy, and we'll do regular checkups every 3 months, if you will, and get a regular check, maybe check an A1C to see if their diabetes is well maintained and so forth.
Now, is there a certain age where you need to start seeing the doctor on a regular basis, or is it just if you've got a problem you go see a doctor? Is there a number?
Well, we start from birth. I mean, you need your checkups throughout life, and we have your pediatric checkups, and then you get to your young adult life, and there's certain things that we have to look for at certain stages. So, and sometimes family history is a big deal too, because we have to look for things earlier than you would for in a regular person who doesn't have that kind of history.
Let's talk about nurse practitioners in practices. Now, you do everything a doctor does, or talk about that dynamic, because I think a lot of people don't realize how important your role is in a medical practice. Inez, you can take this.
We're independently licensed in the state of Florida. We have full practicing privileges. This is
now, when you say full practicing privileges, what does that mean?
This entails the ability to diagnose and prescribe medications, and then we follow the guidelines of the State Board of Nursing as well.
Now, but the doctor who is over the practice puts the blessing on your work, correct?
Well, we are independently licensed in the state of Florida. Actually, a nurse practitioner can have their own practice in the state. We order labs, order diagnostic tests, make diagnosis, and treat the patient, and we prescribe.
What's the most difficult part of working in medicine today? Is it that everybody's bombarded with drug ads, and they think they could get on this and that's going to help them, or I talked to Dr. Okebu earlier, and we talked about the WebMD and how some people try to self-diagnose their problems. What do you guys see as the biggest challenge that you face on a daily basis?
Poor information on the internet. It's people will self-diagnose, and they can take you into all kinds of tangents where you could almost diagnose yourself into a cancer mode if you look at it hard enough.
I mean, can you develop symptoms by what you read? I mean,
it's kind of called, yeah, you can if you read into it hard enough.
You might start having phantom pains, like,
yeah.
Oh, well, it hurts here, and this says this, so that must be what I have.
Well, we did that in nursing school too. When you study something, you start wondering if you have it yourself. So, it's disease of the week almost type of thing. But some people can worry-wart themselves into symptoms. And a lot of symptoms are psychologically based. And you have to weed out really what's an actual physical symptom versus a psychological symptom. And it's not that they're doing it on purpose, but sometimes
the brain.
Yeah, it's a very powerful organ. It can really make you manifest things that aren't really there sometimes. So you have to kind of weed through those things.
Let me ask you a question about people that have colds. It seems like colds. Is it just me, or are colds and the flu getting worse?
I
Are
think
we
so.
are flus lasting longer? Does it seem? Because I think the last couple of colds I've had have really put me, and it may be because I'm getting older too. But do you see colds lasting long and maybe harder to treat?
I think they're lasting longer, or people are perceiving it to last longer because we're an instantaneous society. We want things fixed now, and so you come in with one day of symptoms, and then you want it to be fixed immediately. So that's difficult, and it's hard for us because they're telling us not to prescribe antibiotics, of course, for virals, and people want to feel better immediately. So it's hard to tell them you don't need an antibiotic for this, and they just want to feel better now. So, and that's hard, and we are seeing stronger flus. Last year's flu season was pretty bad.
Inez, I'm going to put you on the spot and ask you, when you got a cold, the best thing to do is
Drink water.
drink water. No, why is that?
And well, you know, we're made out of waters, and we have 75% of the planet to remind us of that fact. And the human body is 70% plus water, the adult, after age 2, wouldn't you agree?
Yeah.
And we are not replacing it in America, even on a daily basis. And I believe we have the high occurrence of UTIs and the problematic cold that lasts on and on because the water helps thin the secretions. And the more water a person drinks, the thinner the secretions, and the better you can get rid of these types of things that hold bacteria in.
If you told me 10 years ago that we would be drinking water out of a bottle and we'd be paying $1 a piece for it, I would tell you were crazy. But with all that's out there, people still are not drinking enough water?
No. I
How many-
have
all right,
patients that say, oh, I never drink water. Or they drink colas, sodas, which is a high sodium content. They drink sweetened tea in this geographic area. And they're just not putting in the water.
How much water should you be drinking every day?
For women, they need at least 2.5 quarts a day, and men at least 1.5 quarts.
And
That's a bare minimum requirement.
And Jennifer, you may have figured this out. Why are we not drinking enough water? Is there just more out there? I mean, Gatorade is not the same as water. Is it close?
It's sugar.
Yeah, it's
So
sugar,
you really
and-
shouldn't.
Yeah, it has a little electrolyte in there. You have sodium, potassium to replace what you sweat off, which people need to do if they're working hard and outside. But water, it's kind of boring for most people. And they have flavored waters now too, which is helping. But they have chemicals when you're adding into that stuff. So you just need to drink water.
So
which-
just
yeah.
plain H2O,
Get over water.
simple vitamin. I mean, there's so much marketing that goes into the vitamin waters, and this water's better for you, and put a little bit. I was at a hotel recently, and they had cucumbers in some water. Is there anything to that?
Infused waters are good. I mean, fruit infused, vegetable infused.
As long as there's
it's
no-
a natural thing. Yeah, that actually gives you some nutrients too, and some vitamins. So.
Inez, would you say that a lot of flus and colds, again, you obviously going to wash your hands because if you're around somebody that's sick, there's a chance that you're going to catch it by, what's is it the mucous membranes that you touch your nose after somebody sneezed on you?
Well, actually, it's airborne. It's in the air. And so if you're the giver of it, cover your mouth. When
But you don't want to do it with
cover
your
mouth
hand.
and cough.
You don't want to do it with your hand, though.
And I actually tell you to hold your arm up, cough in through the sleeve, and of course use a tissue paper if you have it. But basically, even on the internet, the teaching is to turn your head and cough into your sleeve.
And wash your hands constantly.
Oh, definitely.
Let me ask you about this. We've got these antiseptic washes. Is that doing bad? I mean, we're killing all the germs. Are we killing good germs too while we're doing that, if we overdo it? Or are there no
I think
good germs?
with the alcohol hand washes that they're safe. I think they're benign, really, to use those, such as when you go in a Walmart and handle a shopping cart. I mean, there's other bacteria, things that you could pick up. You think of where you've sat the baby and buying groceries and things like that. But no, I really don't think the alcohol hand gels are harmful. I think they're very helpful.
Okay. So hydrate constantly, even before you have
Absolutely.
symptoms of a cold. You should be drinking at least 2 quarts female, 1.5 quarts for male every day.
Absolutely.
And that just keeps things flowing, right? I mean, you don't want to get things where you're not going.
Right.
I think a lot of muscle aches and pains too. People complain about pain and achiness and fatigue. Oh, you're not hydrated. You're not giving enough fluids to all the stuff that needs to be workable. So if you're dried up, everything dries up. So.
Okay, so it's a good rule of thumb to just drink as much water as you don't want to overdo it, but you want to keep as hydrated as possible. What about rest in cold and flu season? Is that overrated? Because a lot of people want to continue to function as if they weren't sick.
I think people need to be rested, especially if they have an actual flu. Too many times people want to go out and push it. They start feeling a little bit better about halfway through, and they think I can just go ahead and push through it, and then they try to go back to work too soon, and then they rebound backwards again, and you may land in a hospital with it. So when we tell you to rest, we're actually telling you to do it for a reason.
When you're getting to the point where you're in the hospital, is that because you're just dehydrated and your electrolytes start getting out of whack, and then you got big problems?
Yeah, sometimes it depends on the type of flu that you have. A B flu especially can manifest with a lot of GI symptoms, a lot of diarrheas, vomiting, and you're going to lose a lot of fluids that way too, electrolytes especially. So a lot of people land in the hospital with low potassium and low sodium. So, and then with the respiratory, the A flu tends to be more that jumps on, sometimes straight into pneumonias. So it's important.
You both spend a great deal of time with patients. You're asking them all kinds of questions to rule out what their ailment is. Let's talk about a specific problem to this area, and that's obesity. For some reason, we don't exercise like we should. We eat a lot of fast food. We eat a lot of processed food that has sugar in it, and it converts to weight, and then other things happen. Mm-hmm. Is that the first thing you talk to patients about when they present with an obese condition, and that they're starting maybe to be on the verge of getting diabetes or on the verge of hypertension, that you start talking about weight loss first things first?
Well, it depends on the patient. If they've come in with a hypertensive disorder, certainly treat that acute need first. But again, you're looking at the total picture of the patient, and if obesity is a factor, then we do mention it. Generally, I casually mention it with a little humor. I'm a fluffy girl, you're a fluffy girl too, let's talk about this. And so the first thing I talk about is reducing the processed foods, as you stated.
Now, when you talk about, let's be clear, processed foods are in boxes like cheese nips and crackers and...
Oh, it's so much more that and so much more complicated. We're looking at the rice, the pastas that have become so popularized. I can remember when I was a child, we never had pasta, but now you can go out to 5 or 6 restaurants just down the street, and
because it fills you up.
It does,
and it's nothing but carbohydrates.
It's very high in carbohydrates, and people need assistance in understanding that carbohydrates isn't just sugar, such as a candy bar. It's in so many of our foods, like our starches, such as the potatoes, sweet peas, sweetened corn, and basically one of the advices that I give is if it's made out of corn, take a second look at it, consider avoiding it, and this includes your breads, your cereals, and eat more of your fresh vegetables, your meats, in order to reduce your carbohydrates, which is a very fulfilling, healthy diet. And another menace that I feel that's in society is the amount of juice that we drink, not only just for the gastric issues it causes, but it's just such an overload of carbohydrates in a small volume.
And what are we talking, just sugary drinks that are or they're real juice?
Mm-hmm.
Like grape juice and apple juice? And
what
about cranberry juice?
Eat a clump of grapes, and cranberry juice is very high in acid, very high in sugar. If you need a cranberry supplement, then take the supplement out of the vitamin section, rather than drinking such a high volume of juice and acid and that overload of carbohydrates, because after a while the body cannot handle the overload of carbohydrates. It was designed for us to use immediately in our muscles and in our brain, and we're not, so it gets shunted into our bloodstream, and that gets transported to our abdominal areas, our hips, our thighs.
Are we living in the 50s still with the way we eat? I mean, you look at folks didn't have a lot of meat to eat for the family, so they would supplement it with potatoes to kind of fill people up. So the starches a lot of times were because there wasn't enough food for everybody. So now, because we're not very active, we're still putting that into our bodies, and it's converting to I mean, French fries.
Yeah, it's the quick and easy foods, and it's expensive to eat healthy. So that's one of the things that patients complain about to me is they would like to eat more fruits and vegetables and get away from the carbohydrates. But simple, those foods are easy to make. They're very easy to buy, and plus you have all the fast food.
Is it a cop out though? I mean, I bought a thing of carrots at the grocery store, and I'll eat those all week, and that's not that expensive.
It is your point. Yeah, it's fun to eat badly.
Yeah, well, it's easy too.
It's easy and it tastes good, and it's you're bombarded with commercials on television all the time about McDonald's and Burger King and all these restaurants and flash all these great foods on the screen, and it's like a draw to eat that. And then if you become a diabetic, of course we're always telling you every 5 minutes you can't have that, and so you tell someone you can't have that, and you just calls your name. So it's difficult to behave and eat well, and you have to want to be healthy, and some people it's just not trained that way.
Well, and exercise, it seems at a certain age you just give up on exercise. Some people do. I like to walk every day. It's something I do for my dog. I'd say I do it for my dog, but I do it for me as well. But you encourage people in the practice that not just diet, but you also need to exercise. What is a typical good exercise routine, or how long should you exercise?
I think the recommendation is probably about 30 minutes a day, 5 days a week. It doesn't have to be 30 minutes at a time either. A lot of patients are like, I can't do that because my knees hurt, or I tell them break it up into increments. 5 minutes at a time. If you have to walk up down your hallway, if you're restricted in where you can go. Swimming is an awesome exercise. If you can go swimming, there's less impact on the joints, burns off a lot of calories. You can exercise even if you're chair bound. You can move other aspects of your body. People get lazy, unfortunately, and they hate to hear that, but we have to tell them you need to get up, and we all need to move. And we all, first thing I tell patients too, like she said, you're a little fluffy, I'm a little fluffy, we all need to move, and it's hard. It is hard. Sometimes have to catch yourself going, maybe we need to follow our own advice.
But if you don't lose weight, if you don't exercise, then other things are going to happen to where, I look at it, you're traveling down the road that if you don't exercise and you let yourself go, at some point you're not going to be able to exercise. You're going to be in such bad shape that exercising is just, and then where are you? So take care of it now. You don't have to get a gym membership, Inez, do you? You can do things at your house.
Absolutely.
We have a beautiful campus here. I don't ride anywhere. I walk to where I'm going on purpose just to get that exercise. Think people should do the same thing?
Oh, absolutely. I have one that just brings to my memory one patient that he walks up and down 2 flights of stairs every day at work, up and down, rather than going to the elevator. And he's in great shape, and he's in his 70s, but he's still working and makes that a part of his regimen all day long.
So he's found a way to do it to where it suits what he needs.
Absolutely.
What can people do before they get to, should you always be exercising? Should you always, I look at, and I'm probably going to catch a little flack for this, but I see people in golf carts driving in their neighborhoods, constantly driving instead of walking. They've gotten to where that's, don't do that.
Especially with older adults with their knees, they start complaining about joint pain, but if you don't move them, you lose them. So we see people in a lot of the carts, and with the children too. We see a lot of children. They're in the video game generation now, so we're seeing a lot of obese children who have poor posture. They're so humped over that they're doing this all the time, so they can't even sit up straight. And so we're trying to encourage these children to get outside. We have a whole generation of people who don't go outside anymore. And deficiencies.
Jennifer, when you can look at outside on your computer screen, why would you want to go outside?
Exactly.
You might sweat a little bit because it's a little warm out.
It's inconvenient. These kids don't want to go out, and it's like a generational change. When we were kids, we didn't come in the house until it was dark.
Right.
Go outside and play.
Your mom had to call you to have you come back in.
And if you didn't come in, within reason, they figured, well, we'll give you a little bit more time. But we didn't want to come in the house. That was just something you did. You went fishing and running out in the yard and playing with your friends and riding bicycles. I see almost nobody riding bikes hardly anymore with kids and stuff. And they use the safety factors a lot of times. It is kind of dangerous. It's not like when we were kids you could go outside unsupervised pretty well, but it's parents need to come outside with their children so they can go out and play and be able to be active with their children too. And I think that we're becoming more and more couch potatoed.
Well, I think our priorities are, we react instead of prepare. And so I think, and I'm going to give you an example, say someone is in an obese situation, they may be in their late 50s, and they say, all right, I got to do something. What do? They call you, and you guys can check them out first, make sure that everything's working properly and they don't have diabetes or they don't have some kind of problem, and then you get them on a regimen of this is what you should eat, this is what you should do.
Well, that is the most important step, is for an individual to recognize that within themselves, I have this problem and I want to take charge of it and I want to do something about it, even if I do have diabetes, even if I do have hypertension, or if I'm 100 pounds overweight. And so that big step is that self-recognition and coming to your primary care provider, asking for guidance, getting baseline labs, getting exercise regimen that's safe and effective, and maybe setting goals with your primary care provider, even just a 5-pound weight loss in a month. Or let's plan for, if you're weighing 215, why don't we make a goal that in 6 months you'll weigh 199, and then you can say, I weigh less than 200 pounds.
I guess it's kind of gratifying when someone has taken your advice and they no longer have diabetes or they no longer have hypertension because they've lost the weight and they've changed their lifestyle. And you can, if you would like to, if you'd like more information about the practice at, I guess it's called Lakeshore Primary Care West, and the location is at 221 Southwest Stonegate Terrace, 101. ShandsLakeshorePhysicians.com is the web address. Inez, Nichols, and Jennifer Scott, we appreciate your time on Perspective. And do it. Go get thin. Go get thin. And thank you for watching Perspective here on Florida Gateway College Television. Till next time, I'm Mike McKee. So long.